In an auto accident, you and your family were lucky to escape without injury. But did you really? Many people experience pain or complications months later when the accident is just a faded memory. Chiropractic care can help and is covered by your auto insurance policy if you are involved in an accident. Don't wait. Make the call. Shillington Chiropractic Associates, 610-775-X-Ray.
Chiropractic Better Health Naturally on BCTV is supported by Shillington Chiropractic Associates.
Good evening and welcome to our continuing program on chiropractic called Better Health Naturally. Tonight we're going to talk about something we hear in the office all the time. People say to us, why does it hurt? Whether it's our neck or whether it's our lower back, wherever it might be, people always ask us, why does it hurt? And especially they ask us, why does it hurt now? This is a live television program, and if you happen to pick this up, you can call us here at the studio and ask questions. The number is 610-378-0426. Okay, I'm your host. I'm Dr. Matt Johns. I've been in practice for 26 years here in the Reading area. And you have to understand a couple of things. Doctors of chiropractic look at the spine differently than most people do. They look at the body differently than most healthcare professionals do. But let's give you a typical example so you can hang your hat on this so you can understand how we do this. A patient comes into us and says, well, my neck hurts, my back is locked up, or I can't rotate my neck, it's stiff, it causes me a lot of pain. And there's some type of activity that they have done, whether it's summertime now and it's gardening or whatever it might have been. And they usually precipitate the symptoms that they're having to working in the yard, let's say. So we sit down, and this is very important. You have to give your doctor an accurate history of all the trauma that you have accumulated in your life. Now, many times when we have car accidents, the average American has a car accident once every 10 years. And that could be a tap in the parking lot when you're just backing up and you hit somebody or somebody hits you, or it could also be a full head-on collision. But the average is once every 10 years you have a car accident. Now, many times when people have the car accidents, let's say in this particular example, the idea that brought this to mind was a patient that came in the office and said, you know, I haven't had any real car accidents, and when we explored her history further, we discovered that there was a severe car accident 10 or 15 years ago. Her brother was in the car with her, and the car rolled over. Now, even though they still had their seatbelts on, you still bounce around inside the car and cause significant trauma as you impact the inside of the car. Just the whiplash alone is enough force to misalign the bones in your neck. For example, Volvo, the manufacturers of the cars and the big trucks, says if you're a 185-pound man and you drive your car into a brick wall between 30 and 35 miles an hour, approximately 4,000 pounds of force push you into the dashboard if you don't have your seatbelt on. So that's 4,000 pounds measured here on our torso, on our chest area. For your neck, if you have 4,000 pounds here, it's 8,000 pounds of force here. Now, this is only a minor car accident at 30 to 35 miles an hour with an unbelted passenger. Obviously, if you get up to 60, 65 highway speeds and you have a full head-on collision at that speed, you really have a lot of things to be concerned about. But in this particular example, let's stick with this particular woman. She had an accident 10 or 15 years ago. The car flipped over, and now she comes into the office and she's got severe neck pain. In fact, there's something that we call spastic torticollis, where the muscles in the neck lock up because the body's intelligence understands that you're putting pressure on the nervous system. And when you do that all the muscles lock up to try and protect your nervous system. We call it a guarding response. So this particular woman says, well, I don't know that I had a bad car accident, so this is also very important. Whenever you have a car accident, always request x-rays. So we took a couple x-rays of her neck, and what happens, we have a chart here that we'll get to in a few minutes, is she lost the curve in her neck. Now, here's a picture of the different stages of degeneration. This one here is a picture of your neck from the side. And it's very important that you understand the normal curve that we have. I'll go over this in a 3D model in just a minute. But most people come in to see doctors of chiropractic when the neck curve has gone straight. And then as time goes by, 10 or 15 years pass between this x-ray and this one, and you can't really see it too good on this chart, but the space of the discs wear out. This is analogous to, let's say you hit a bad pothole with your car and you knock the front end out of alignment. You don't really know the front end is misaligned until 5, 6, 7, 8, 10,000 miles later, depending on how bad and how severe it is. But what you notice is the misalignment in the tread wear pattern on the front tires of the car. Now, here's another example. Here is a three-dimensional model of the spine, and this is the curve that we're talking about here. This curve in our neck is a curve that we're not born with. We're born with a C-shaped primary curve when we're in utero, and then as time goes by, when we lay in our bellies as a child and we learn to stretch our necks and pick our necks up, we develop this curve in our neck, and then we develop a similar curve in our lower back when we learn to crawl, when we can tuck our legs underneath our belly and crawl around. So these three curves, the curve in the neck, the primary curve that's in the rib cage, and the secondary curve that's in the lower back, make our back 18 times stronger than our nearest biological cousin, which is an ape. An ape walks around upright sometimes, usually on their knuckles, most of the time on all fours. But when you lose this curve in your neck does something classic. We call it a lost curve, and your neck goes straight. Now, this will not bother you after the initial insult to the muscles and the nervous tissue wears off from a car example or a car accident that we're using in this example. But as time goes by, these discs in your neck are just like the tires in the front end of a car. When the front end hits a bad pothole and it misaligns itself, you wear out the tires. When you have severe neck trauma, when your head snaps forward and backwards, we call it whiplash. You have severe trauma to your neck, you usually tear connective tissue. You line in the spine, loses its curve, and in losing its curve, 10 or 15 years go by, and then you present yourself, or you have these symptoms where your neck is locked up and you're having severe pain. Well, this is the classic scenario that we see. But what people also don't tend to understand many times is there's two parts to the nervous system. There's our voluntary nervous system, which is what we use on a daily basis. And you don't really know that it malfunctions until, let's say with this example we're using here with a car accident, you get tingling or numbness in your hands, or you lose sensation, you feel like your hands are falling asleep or something of that nature. Well, here we're going to show you a picture of what's called the autonomic or the automatic nervous system. And here is a picture of the spine, and this is something that we all innately understand. The voluntary nervous system makes us feel and we can move our hands voluntarily. But the internal organs in our body are controlled by this system called the autonomic nervous system. And there's something very important that we have to understand. If we took away everything that we see in our bodies, the bones, the skin, the muscles, and we left you with nothing but the nervous system, we would still recognize you as the individual you are. Because the nervous system is so, not invasive, so pervasive, it's in every cell in our body. It is the master control system of our body. Now, if you think about this for a little while, you'll understand this. Our fingernails grow, our hair grows. Also, the body turns over on a regular basis. For example, the internal lining of our GI tract sloughs off every 3 days, just like a snake sheds its skin. And that continual process of the cells breaking down and repairing and dividing and making more happens, and the average is about every 7 years you have a complete new body. Well, this particular patient that we're talking about reminded us of something, and that's what the show is about tonight too, is not just the trauma that we receive from car accidents, because the old saying is all trauma is cumulative. When you misalign your spine, the answer to the question is, why does it hurt now instead of 10 or 15 years ago when I had the initial trauma? The answer is, it's because you have not worn your discs out initially. It takes 10 or 15 years after you misalign the spine to wear the discs out. And then when you wear the discs out, the nerve roots come out in between each bone. And those nerve roots have main highways, if you will. They're kind of like a circuit breaker box in your house, where each different area of your spine, each different area of your body is controlled by a different set of circuits. So when we initially took pictures or x-rays of this patient, we noticed that she had a loss of curve in the neck. And we explained that to her, we adjusted her, and after we adjusted her a couple of times and got her out of pain, then she asked more questions. And then she also found out that the thyroid gland, which is about the shape of a butterfly here, this is the master control gland of our metabolism. So she said they took pictures in the hospital and followed up with more x-rays that we had taken or started at our office. And they noticed that her thyroid gland was about half the size that it should have been. Now, I also have to say that the loss of curvature in this particular woman's neck was very severe. And when she explained this to me, she was rather upset because one part of the thyroid gland had a little growth on it, and they biopsied it and found out to be non-cancerous, it was benign, and they just let it be. And she was a little concerned about that as well. But this is the process that we're talking about that we all take for granted, where we think about our bodies automatically rebuilding themselves and rebuilding the cells healthy. But the highway that your body uses to lay down new tissue and grow new cells is stimulated and controlled by the nervous system. So in this particular lady's instance, when we get the neck operating right and 100% of the nerve energy comes down from the brain is like a 40-watt light bulb. The energy is made here, it has to travel down the spinal cord, come out between each one of the bones in your neck, and there's 7 bones in your neck. There's 8 nerve roots, but there's 7 bones. And that energy, we call it the vital energy, the life force. Some other people call it the innate intelligence. It sounds like Star Wars, I know, but this is the energy that makes your body work. So if you turn off that energy, voluntarily, we feel it in our voluntary nervous system. When our hands go numb, we get pain in our neck. But there's more to it than that. That's only half the picture. The other half of the picture are all the organs that work off the body's autonomic nervous system all by themselves, and you never know about it. Let me give you an example. Christopher Reeves, unfortunately, is an example of this. He broke his neck when he was thrown off a horse. He was riding with his horse and he was jumping and he fell out of the saddle, landed on his head, and broke the 3rd bone in his neck. Now, when that happens, you put direct pressure on the spinal cord, and that's what he turned into, was a quadriplegic, where he has no control over his arms and he has no control over his legs. This also goes for the internal organs. They're already on automatic. Let me explain it this way. When we're born, our autonomic nervous system is functioning. But as we grow, the voluntary nervous system has to grow into all of the organs. Let's take the bladder, for example. In a baby, the bladder has an autonomic nervous system that works automatically, but the voluntary nervous system has to grow into the involuntary nervous system or the autonomic nervous system, and then the baby will understand as time goes by, 2, 3, 4, 5 years old, they learn how to control the bladder. So that when they're under the involuntary nervous system, the blood goes through the kidneys filter the blood, the kidneys make urine, it goes into the bladder, When the bladder gets up to a certain pressure, the valve at the bottom of the bladder just opens up and the baby wets their diaper. As time goes by, our voluntary nervous system grows into the bladder so that when we get older, we understand that the bladder has that sensation sent to our head, and that's the sensation that we have to go to the bathroom. So this is what happened with Christopher Reeves, for example. But you only see it in severe cases like this because you have to remove the voluntary nervous system before you can see the automatic nervous system working. So these are things that we try to explain to our patients, but the most important thing that we feel all the time is the pain that we experience. That's what usually brings patients in. There aren't too many patients that come in and say, you know what, my bladder isn't working well, my bowel isn't working well, but patients often experience this after they get a chiropractic adjustment. Because by putting the spine back in line, we remove the interference where the nerves are receiving pressure usually from the discs that are misaligned, and the discs are putting pressure on the spinal cord or the nerve roots that come out of the spinal cord because they are not properly aligned. And this happens over time. But patients come to us and they say, you know what, I'm sleeping much better. I have more energy. I can go to the bathroom better, things of this nature. We often hear this over many years in practice, and this is almost something that we expect patients to tell us. So, and there's often times too when patients don't remember or tell us everything right away, and they say, you know, I never told you this, but I'm having so much better progress with this little thing that used to bother me, and now it's disappeared. So this is the way we were designed. We were designed for our automatic nervous system to take care of all these different functions, but it's controlled by our nervous system. And as time goes by, our bodies learn how to do this. In fact, in the chiropractic profession, we call the lack of nerve supply dis-ease, D-I-S''ease. When you put the word together, you have disease, but this is an indication where you know your body doesn't feel or function as well as it used to. And usually this is related to the problems that we have with our nervous system. Okay, we have a few more minutes here. The other thing that I wanted to talk about too is politically, the Obama situation has taken a new route. If you've been watching the news, you've seen that the Supreme Court has once again upheld Obamacare. And this is 2015. This is the end of July. The next phase of Obamacare is going to happen in 2016. And in 2018 is another major phase of Obamacare. But basically what's going to happen is all the people that have corporate insurance where your company pays for your health care will now have to sign up for Obamacare. And we've seen all the different things that are happening with Obamacare, so we're waiting kind of for the next political election to happen and see what happens, but the Obamacare has been a nightmare. So we just want to warn you about that ahead of time. There's some interesting things happening politically. If we have time to go into them, we'll continue here until we're told that our show is over. But we are not advocates of vaccination. Now, I have to explain this a little bit because if you go to a foreign country where you don't have an opportunity to be immune to any of the diseases that are inherent in a foreign country, well, then you really don't have much of a chance. I'm talking about vaccinations here in the area where we grow up and where we live. And right now there's a big dilemma with Planned Parenthood, but what people don't really understand is that fetal tissue has been used to make vaccines since 1978. And right now the autism rate is at 400%. You don't get a 400% increase in the disease unless it's artificially stimulated. So what's happening now with vaccines is the vaccine manufacturers take fetal lung tissue, and that's what they base the vaccine in. That's the medium that they grow the vaccine in. And ever since they've done that, they've had this terrible increase of autism. So there are a lot of different reasons. We can explain all of these things to you. If you have any questions, you can call us. You can call it the show here. The show has a website. It's bctv.org. And on all of these different communication devices, you can get a hold of us and ask us questions. But The idea here is when you have measles or mumps or smallpox or chickenpox when you're a child, you develop lifetime immunity. Your body actually makes 5 different antibodies for each one of these diseases. And then it puts the one antibody on a shelf. It's called the T4 lymphocyte. It's the one that AIDS attacks. But when you're exposed to it again later on in life, your body pulls that particular antibody off its library shelf. It puts it into your immune system, into production, and makes the other 4 antibodies that go with it. And then you can fend off. You probably won't even notice that you have measles or smallpox or mumps or whatever. It's important to understand this relationship because the federal government has a deal with the pharmaceutical companies that will not allow you to sue them in case your child or you or anybody else is injured. The maximum settlement that you can get is if you pass away due to complications after a long, lengthy process of legal battles is $100,000. And that's because of a deal that the federal government has made with the pharmaceutical manufacturers in case somebody takes an airplane and flies over our fields here and dusts us with anthrax. So these are all things that you need to consider, and they're important for your health. But the other thing that happens when if you've been exposed to all of these diseases when you're younger, and then you get an injection for measles or mumps or smallpox, the inoculants, beside the fact that they have mercury in them, which is called Thermosil, and Thermosil, if you talk to the people that give you the injection, they'll say there's no mercury in the injection. And if you look at the list of ingredients, they'll list Thermosil on the ingredients as a preservative. Well, Thermosil is 50% mercury, methyl mercury, and it's a very lethal type of thing. For it's a 250-pound man, a regular amount of Thermosil in one vaccination is a lethal dose. So we wanted to tell you about that. While we're on the thyroid too, there's new evidence that has come out that says the fluoride in our water system attacks the thyroid. Sometimes you might have heard there are a number of different people who are obese in this country, and one of the problems is because the fluoride in the water attacks the thyroid and doesn't allow it to function. Earlier I said the thyroid is like the thermostat in our body. You can turn it up or you can turn it down. Your body does that automatically if it's healthy. If it's not healthy because we've been drinking fluorinated water all of our lives, then it becomes hyporeactive or less reactive, which means your metabolism slows down, so you eat the same amount of food, but it turns into more adipose tissue on you. So that's also something that you can Google. You can Google the things about vaccination on the web. You can also Google the things about fluoride on the web. So there's 2 types of water you need to drink. If you're getting city water, you need to run it through something called a net zero water filter. You might have seen this commercial on television. The commercial has 2 glasses of wine in rocks glasses. They pour them into a Brita pitcher and they pour them into a net zero pitcher, and the net zero pitcher removes all dissolved solids. They call it total dissolved solids. They even give you a little pen to stick in the water and see what the total dissolved solids are. That's one way you can do it. The other way you can do it is with a system that you can get at Home Depot or Lowe's. It's called a reverse osmosis system, and that's what we recommend for all of our patients. So that your thyroid, what happens is if you look at the periodic chart, fluoride is a much more reactive molecule than iodine. And your thyroid has 4 different molecules of iodine on it. So when you drink fluoride, you knock the iodine off over a long period of time. We don't recommend that you use fluoride in your toothpaste because of the same problem. So these are all little things that need to function, and like this particular lady we were talking about that came in and told us about her neck pain and then told us about her thyroid problem, remember, there's a nerve fiber that goes into every cell in your body. In order for your body to function right, all the nerves have to be supplying 100% of the power to the nerves, to the body, so they can function. And this show will be repeated again. The website, once again, is bctv.org, and this show is on channel 11 on Comcast Cable. It's not on DirecTV, but if you have any questions about anything we talked about tonight, we've been more than happy to talk to you. Our number at the office is 610-775-9729. Thanks again, and we'll see you next month. Good night.
Have you been injured on the job? Has your pain lasted for an extended period of time? Have you reported your injury to your company? Have you been examined by a company-authorized doctor? Did they say you were ready to go back to work while you were still in pain? You have certain rights, including visiting other doctors. In many cases, chiropractic care is more effective in relieving pain from back injuries. Call 610-775-X-Ray today and let Shillington Chiropractic Associates put you on the road to recovery.